Well, a nice smile is rather important, but there's a whole lot more to having a healthy mouth than just a bright smile. Dr. Martin Goebbel is a dentist with Southern Blvd Dental Center in Rio Rancho and joins us this morning to talk about how your teeth and your mouth health interact with your whole system. Dr. Goebbel, thank you for being with us today.
Pleasure to be here, Nikki.
You have a lovely smile yourself, I must say.
Thank you.
You must have a very good dentist.
My associate does as well.
I would assume so. Well, let's talk a little bit about this because, as I said, it goes beyond just the smile. Tell us a little bit about the oral systemic, how do you say, systemic connection?
Yes,
oral systemic connection. Okay, so explain that a little bit.
Ongoing research has found a link between gum disease and whole body health.
Wow.
And this link is paramount in keeping your whole body healthy.
How is that so?
The gum disease affects your heart health.
Okay.
It can increase your risk of heart attack twofold.
Wow.
It can increase your risk of stroke, of Alzheimer's, of oral cancer and colon cancer. It can increase your risk of becoming diabetic. And if you are diabetic, it can make controlling your blood sugar much more difficult.
Oh my goodness, I'm very surprised.
In pregnant women, it can cause preterm birth and or low birth weight babies. Gum disease can cause kidney problems.
Wow.
It even can affect men and erectile dysfunction.
Oh my God, well, why does this occur?
Gum disease is caused by bacteria.
Okay.
These bacteria cause a breakdown of the lining of the gum tissue.
Okay.
When the lining breaks down, it's similar to scraping yourself. You've broken the barrier that keeps these bacteria from entering the bloodstream. Well, when they enter the bloodstream, they trigger an immune response.
Okay.
And that starts with the liver making a compound called C-reactive protein.
C-reactive protein?
Yes.
Okay.
There are now some cardiologists that feel that the level of C-reactive protein is a better indicator of potential heart attack than cholesterol levels.
You are kidding me. Because people think cholesterol, they think high cholesterol, heart attack. They don't associate, I would never associate bacteria in the mouth with a heart attack.
Well, gum disease is probably the most prevalent of all diseases afflicting the American population.
Oh my goodness.
American Dental Association estimates say that 75% of the population has some form of gum disease.
Well, how do we control this? That's 75%. That's a lot. Who's at risk?
Everybody is at risk.
Okay.
There are those that have genetic predisposition to it.
Okay.
We actually have some DNA testing that can find what your risk factor is.
Oh, really?
And it's a simple taking a saliva sample and testing it. We use that same saliva sample to test for the different types of bacteria that are present.
Okay.
Everybody's mouth has more than 500 different types of bacteria.
I would imagine.
And it's a warm, moist place. Bacteria love that.
Yeah, absolutely.
Because periodontal disease is caused by bacteria, it's also contagious.
It's contagious?
Yes. You can pass it from yourself to your children, to your significant other.
So is it as simple as having a sip of something and having somebody else have a drink? If you have it, that you could pass it on that way?
Certain of those bacteria can be passed that way.
Wow.
But the thing that differentiates is the strength of your immune system.
Okay.
And your heredity.
So genetics, like you said, do play a role.
Exactly.
Well, now, okay, so this obviously is an issue. So how can it be treated or prevented?
Treatment involves removing the risk, the causative factors.
Okay.
And that's biofilm, which is dental plaque. It's removing the tartar that builds, because that's where those bacteria live. And not only can we remove those, but we, in my office, have gone to the use of a laser, which actually goes between tooth and gum and vaporizes the bacteria.
Does it hurt?
Very little discomfort.
Okay, good.
Most of the time we do it without anesthesia.
Really? Okay, that's a little more comforting. Makes me feel a little bit better. So, I mean, overall, would you say, I mean, everybody always says, get your teeth cleaned twice a year, make sure that you get the tartar out. I mean, it's not a cliche. You have to make sure that you do this religiously. Don't you agree?
You have to do it, and depending on your susceptibility, somebody may brush once a day and be fine. Somebody else may need to brush 4 or 5 times a day.
Really? So would you basically guide somebody once they've come in for a cleaning, and then you see what especially if they do the DNA testing, I would imagine?
We customize treatment for the patient.
Okay.
Not everybody needs laser.
Right.
And some people need laser and need the cleaning appointments more frequently.
And then at that point, that's when you can tell somebody, hey, you need to make sure you're brushing at least 3 or 4 times versus somebody who's okay with just once or twice a day.
Exactly.
Okay, and of course, if you want to make sure that you are in perfect dental health, and of course for preventative methods, especially to avoid any kind of problems, we have the address for you to go to for the Southern Blvd Dental Center in Rio Rancho. Dr. Martin Goebbel, we really appreciate you being here because this is an issue I think a lot of people are unaware of, and I'm sitting here. It's rare you see me speechless, but I'm just shocked because I really did not associate all of the things that could go wrong with your whole body because of the problems that you're dealing with your mouth. And you see, so you're saying 75% of the population. Are you seeing this as far as, real quickly, demographically, any more in older people than younger, or more men than women? Any specific demographic?
It's pretty much across the board.
Is it really?
It's pretty much across the board. And as we get older, our immune systems become more compromised. So anything that you can do to help improve your immune system is also going to help your dental health.
Absolutely. Okay, thank you so much, Dr. Goebbel. We appreciate you being here. And of course, now you know, well, it's our pleasure to have you, and you know exactly what to do.